this is caused by a genetic defect or an accidental removal of those parathyroid glands. So we go in and we do a thyroidectomy, and maybe those glands that were super close nuzzled up to the thyroid gland, we pull out the parathyroid glands at the same time. So very rare to have hypoparathyroidism, but it can happen because they're tiny and they're really nuzzled up and they're tight. Okay, again, possibly remove them during thyroid surgery. It could be idiopathic. Maybe they don't have the parathyroid glands at all. Severe hypomagnesemia can suppress the parathyroid hormone secretion. It can be caused by vitamin B deficiency as well as chronic kidney disease. But know that it's not super common. Okay. So because they have hypoparathyroidism, we have low calcium. Okay. So they may experience smooth muscle spasms. So they're going to have low parathyroid hormone, which means they have what calcium? Low calcium. And what for their phosphorus? High phosphorus. Okay. Do you guys know what Chbostik's sign or trousseau? The cheek. So they tap it. I'll show you a video here in a second. Tap the cheek is Chbostik's, and I think cheek Chbostik's. I may be saying that wrong, but okay. Trousseau's, it's when they like squeeze the blood pressure cuff on their upper arm and their hand will turn in, and it, in my mind, I think weird things. This looks like a T. Like I look down at it, it looks like a T. No, nobody else is T. No. Okay, well that's how I remember. Okay, so Chbostik's cheek. T. I'm trying here, people. I'm trying.
We won't forget.
I'm trying. You won't forget now. You laughed at me, everybody. Okay, so tetany. Remember we talked about that? Tetany? What is that? Is that circumwheel tingling or numbness? They might feel in their fingers and their toes. That's going to tell us that their calcium is low. This is cool. So which one is that? Chbostik. Cheek. So they're tight. You can see the blood pressure is increasing, or they're tightening the cuff. Did y'all see his hand go in?
Mm-hmm.
Yeah. A little bit. That was not as noticeable. But the cheek. And what does this mean about their calcium?
It's too low.
Okay, his hand kind of starts out straight, and then he's going to make a T with it, right? Very slightly. He's doing it. Yeah. Close. Yeah. There you go. There's his T. Okay, I tried this. So that's going to show us that we have low calcium. Okay, so what can we do with these patients? Okay, so they have hypoparathyroidism, so they have hypocalcemia. So if they have tetany, they tell you, these patients, you can say, hey, listen, if you start to feel some tingling sensation around your mouth, your toes, anywhere really, let me know, because we're concerned about you having too low calcium. So what we can do with these patients, we can give them IV calcium. We want to give that very, very slowly because we're worried about their heart, right? Cardiac effects of that. So they're going to be on ECG monitoring. We're going to be watching for hypotension, dysrhythmias, cardiac arrest. Okay, so you guys are getting ready to take our nutrition test on ATI. So these are some high calcium foods for you. So dark green vegetables, soy, tofu, high calcium, tofu. And then why do we want to teach them to avoid high phosphate foods? Right, it has an inverse relationship. So if we're doing some nutrition teaching on a patient that's hypoparathyroid, We're going to think their calcium is low. We want them to increase their calcium, but not have as much phosphate. Okay. And then encouraging these patients. It's really, really important for these patients, all of these patients we've talked about today, to be continuously followed by their physician or their endocrinologist, or whoever that may be. But it's very, very important for us to educate them on why they need that, to educate them on signs and symptoms that something may be wrong, something may be awry. We're just talking about how weird that is spelled, awry. So something may be going on there. So it's really important for us to teach them. You guys are all educators. I think I've said that to you guys before. If I haven't, I'm saying it now. You guys are all educators. You don't stand up here and you don't lecture, but you guys are educators with your patients. Okay, so don't forget that. Okay, any questions? Okay, so that was really short and sweet. Hypo, the parathyroidism, just focus on knowing what's our calcium doing and what are our concerns when our calcium does that. Okay, what do we have to worry about? Okay, okay. I'm going to move on to question or doing some NCLEX style questions on the topic. If you guys are good with that. Actually, let me pull up. I've got a quick case study that I'm going to see if it downloaded for me. Okay, well, it didn't. It's a sign. We'll take it as a sign then. That's not hard. It's a sign. Let's hop into a poll everywhere. And I encourage you guys to participate in the poll everywhere. I know it seems like you can just sit here and you can get the answer, but whenever you have to like walk into an answer and make a decision on an answer and stand by your answer. It helps with your learning. It really does, for you guys to understand why maybe that wasn't the answer. Instead of going, oh yeah, I would pick that one, right? It's easier to go, oh, I would pick that one. Let me see if I can hide this. Oh wait, I know. No, hold on, give me a second. Here we go. Okay. Sorry, let me pull it into the right window here. Okay. Get signed in on that. I really like using, you don't have to like create an account. You could bypass create an account if you do it on your phone. I know some of you guys record the lectures, and I love that. I think that's great. That's how I learned too. Don't share these questions. These aren't like my questions. I got these from other places. But don't like pass this on to the next class because it takes away from their learning of the material. So do me a favor and don't do that, okay? Okay, you guys ready to go? Anybody still signing in? Take that everybody is signed in. Okay, go ahead and answer. Some of you already are. Okay, go ahead and answer. I want you guys to read it. A nurse is working on discharge instructions for the client with Hashimoto's thyroiditis. What do we know about Hashimoto's? Low, okay, so it is hypothyroidism. And what kind of hypothyroidism is it?
Autoimmune.
Autoimmune, very good. Okay, so which of the following should be included by the nurse for discharge education to the client? So only take medication when symptoms appear. Why did we not want that? Nobody wanted that one. Rightfully so.
Because you take it at the same time every day.
Okay, they should take the medication daily, same time every day, right? So we don't answer that right. Okay, follow up with the healthcare provider within 2 weeks if they're not feeling well. Why or why not? You guys can speak to either one of these. That's right, that's true. Just a follow up no matter what. Okay? Just to ensure that it's working properly. Okay, how about follow up with a primary healthcare provider within 2 weeks after TSH labs?
Same thing, make sure it's working well.
Yep. We want them to make sure to follow up after those labs are done to make sure that everything is working. Okay? How about avoid physical activity for 1 month after starting levothyroxine? No. Why not? Doesn't really have anything to do with their physical activity. It's not really relevant to this. Okay? So the answer was C, or the third one. All right, let's go to the next one. This is a select all apply. You should be able to select multiple here.
Nope.
You can't. I tested it today. Okay, we'll select the one you want to select.
It's
I tested it today. I promise, guys. Okay. Is anybody able to select more than one? What a crock. I really promise you I did. Okay, so let's look at this. The nurse is caring for a client that has Hashimoto's thyroiditis. Which of the following symptoms should the nurse expect with this patient? Okay, so Hashimoto's thyroiditis, they have hypothyroidism, so thinking low and slow. So when you guys are sitting here with these NCLEX questions, test questions, they're not all going to be able to be grouped like all the Hashimoto's questions are together and all of that. But if they mention a particular disease process like that, if you have to write down hypo, slow, and think through that, and then when you get a question and it's hypothyroidism, and help jog your memory back to that thought. Because I know it's hard to flip-flop and you're like, there's a high, there's a low of everything, and I have to remember it all. If you can remember a few of those things, like you get to a Hashimoto's question, you're able to write down some information about that question, so maybe that might jog your memory later on. Does that make sense? Okay, so we know low, slow, we kind of talked about that in the last question. So this patient, you're gonna see fatigue? Yes. Long bursts of energy? No. Okay, that doesn't even go together with fatigue. Weight loss for these patients? Yes or no? No. Okay, these patients, low, slow, think their metabolism is slowing down. Weight gain for these patients. Intolerance of cold? Yes. Okay. Overheating? That's the opposite, so now you all want to answer that. Rightfully so. Well, never mind, didn't work right. Okay, next one. Again with the Hashimoto's. I need to move these around a little bit next time. client is diagnosed with Hashimoto's thyroiditis. Okay. The client does not fully understand the disease, so which of the following explanations should the nurse provide to the client about Hashimoto's? It's caused by taking levothyroxine. No. Right. What does levothyroxine have to do with this patient? They'd probably be taking levothyroxine, right? Because they're low T3, T4, so they might be on levothyroxine. So it wasn't caused by levothyroxine, but they might be on it. Okay, it's an autoimmune disorder that occurs because the thyroid is absent. Why or why not? It's not absent, right? What's it doing? It's not working, right? It's attacking itself, like the immune system is attacking itself, so it's not secreting these T3, T4. So it's still there, it's just not working like we want it to work. It is an autoimmune disorder that may be triggered by many different factors. Yes. Okay. So it can be triggered by lots of different factors. One of the things that I didn't mention is sometimes women after pregnancy will end up with Hashimoto's within like 6 months after the pregnancy. That's one of the commonalities. So it can be lots of different factors that triggers this autoimmune response to the thyroid. Okay, it's caused by too many thyroid hormones in the body. No, it's the opposite, right? Okay. 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 So I was worried we'd have an issue with this one. Okay. Okay, so a client has a history of hypothyroidism and must take daily supplements of synthetic thyroid hormone. Which vital sign changes would indicate that the client may need to have an increase in their thyroid medications? Okay, so hypotension. Okay, I don't think I explained this well to you guys. So hypertension, hold on. Okay, hypertension could be a sign of hypothyroidism, and I know this is backwards, don't dwell on it too much, because there's an increased peripheral vascular resistance, okay? So that one doesn't go with the hypo, so don't hate me, but just know that high blood pressure can be associated with hypothyroidism, okay? That one kind of doesn't run along with it, and I didn't explain that too much. So I understand why you wanted to say that, but that's why that's not the answer, okay? Hyperthermia is a symptom of what? Hyperthyroidism. Okay, tachypnea, hyper, okay? Bradycardia, hypo, okay? Okay, let's go to the next one. Okay, a 31-year-old client, she comes into the healthcare center for help with an emotional disturbance. The provider diagnoses the client with hypothyroidism. Which of the following psychological conditions is most likely associated with hypothyroidism? anger and aggression, not really associated with hypothyroidism. Dementia, I did mention that they don't think and process as well, but they would not be diagnosed with dementia because they have hypothyroidism. And then depression is the correct answer. Are these questions helping you guys?
Yes.
Okay. Now this one, you should be able to select multiple answers. Okay, you guys ready for me to lock it in? Ooh. Okay, I'm locking in. So someone is taking an anti-thyroid medication. Why might someone be taking an anti-thyroid medication?
Too much.
Hyper, right? Too much. Too much T3, T4, okay? So, I read this question. Whatever my answer is given to somebody who has too much T3, T4, okay? Let's see what we wanted to say. Okay, kind of across the board. Okay, hyperthyroidism. Do they have too much T3, T4?
Yes.
Yeah, so they're gonna be taking an anti-thyroid medication. How about somebody with Graves' disease? What's Graves' disease?
Autoimmune
Autoimmune
hyperthyroidism.
hyperthyroidism, very good. So they're gonna be taking an anti-thyroid medication. Okay, myasthenia gravis.
What's that?
Yeah.
It's a neurological disorder that we did not get into today, and it has nothing to do with our thyroid. Okay, so then we need to take anti-thyroid medications. Okay, patient in a thyroid storm. What's a thyroid storm? We have toxic levels of T3, T4 circulating, so anti-thyroid medication would be great for these patients. Hypercalcemia.
Has to do with the parathyroid.
That has to do with the parathyroid, different from the thyroid. Okay, so we wouldn't give anti-thyroid medication for parathyroid. Okay, I guess so. It does say thyroid. Okay. Next one. Should be able to select multiple ones. Okay. Are we ready? No. Oh, wait. Okay, we ready now? Are we still thinking? Okay. Let's take, oh. All right, let's take a look. Okay, so we're all across the board. So a nurse is caring for a client who has had a thyroid surgery, okay? The client's calcium result has returned at 7.5. Okay, so you guys are going, that's not the parathyroid. We talked about calcium parathyroid, but I also said what can happen if we do a thyroid surgery?
We take out
We
the.
could take them out, we could stun them, we could stimulate them, the parathyroids. So they are kind of connected in that sense. Okay, so they had a thyroid surgery, something happened, maybe with the parathyroid, because our calcium level is returned at 7.5. What is normal calcium levels?
9 to 11.
9 to 11, so low. So this patient has hypocalcemia. So what nursing interventions are the most appropriate based on this patient having a low calcium level? Okay, so one of the symptoms of hypocalcemia, and I didn't mention it, is seizures. Did you guys know this? Yes. Perhaps you've heard this before. Okay, So we may need to implement seizure precautions for these patients. What about furosemide?
No, it's for hyper.
What would happen if a patient, what happens to calcium levels what's a side effect of diuretics? It can cause them to go down. Okay, so they already have hypocalcemia, so to give them a diuretic is probably not a good idea. Okay, administer intravenous calcium gluconate.
Yes.
Yeah, that's a great idea, right? We have low calcium, let's give them calcium. Okay, assess for signs of hypocalcemia. Yeah, they already have it, right? We know that, they're already showing, I guess they're not, but they could be showing. If they've got seizures, those are signs of hypocalcemia. Assess for signs of hypercalcemia. No, because we know their lab value is a low level for calcium. Okay?
What does ACTH stand for again? I cannot keep it in my
I'll
head
tell you in a second.
to save my life.
Okay, you guys ready? Okay. Hospitalized client has been diagnosed with Graves' disease. What is Graves' disease?
Autoimmune.
Autoimmune
There you
hyperthyroidism.
go. Autoimmune hyperthyroidism. Okay, so this patient has lots of these hormones being spit out. So what might we do for these patients? Okay, what's the most common treatment for this patient? Okay, radioactive iodine. Most of you guys wanted to answer that. What do you guys think? Yes. Okay, that is the most common treatment, is that radioactive iodine therapy. So my mom had, so I say she has a goiter, but when I say goiter, I'm not saying like she had a big goiter. She just kind of had an enlarged thyroid. I mean, it's just kind of, her neck just looked a little bit thicker. So she went in and found out, I always thought, because my mom, she's a really good mom eye. You guys know the mom eye where it's like I'm watching you? My mom had a really good mom eye, and I was like, after I found out that she had hyperthyroidism, I was like, ooh, I wonder if she has Graves' disease, because like, she has a good mom eye. So anyway, she ended up having this radioactive iodine therapy done. And so that's how I remember it, is thinking like Graves' disease, and my mom's like mom eye, like that exophthalmos look, and she's good at it. I really think maybe they misdiagnosed her. And I can diagnose her based upon symptoms. But so she had to have this radioactive iodine treatment done for her. So thyroxine, what's thyroxine?
More.
It's a thyroid hormone, right? Triiodothyronine, what is that?
A big word.
A thyroid hormone, right? Those are T3, T4. Would we give somebody with Graves' disease T3, T4? No. Okay. Who wants to tell me what ACTH is?
Adrenocorticotropic.
There you go. Adrenocorticotropic hormone.
I was right.
Okay.
Ah.
And that is a hormone from the pituitary, that the adrenals regulates what in the body? Cortisol, right? Different endocrine systems, right? Okay. Different part of the endocrine system, I should say. Okay. Next one. Okay, so a nurse is reviewing discharge education with a client. Which of the following should the nurse provide to the client diagnosed with parathyroidism. So when we hear parathyroid, we think
Calcium.
calcium. And when we think hyper, we think
High.
a lot, high, right? So this patient has high calcium, okay? So let's see what we want to talk to them about. Okay, so should we talk to them to avoid foods high in calcium? If they have high calcium and we're concerned that they have too high of calcium? Yeah, that would be a good education point. Limiting water intake? No, we want to encourage water, right? I want to say it so bad. Dilution is a solution. Okay, I hear you guys saying it. Okay, avoid foods high in phosphorus.
No, eat them.
If they have a high calcium level, they're going to have a low phosphorus, so we actually want to encourage foods high in phosphorus. Okay? Eat foods high in calcium.
No.
They have hypercalcemia, we don't want lots of calcium, right? Okay?
So if they have hyperparathyroidism, isn't that pulling calcium from their bones?
Into the vascular system.
So if you were to eat foods higher in calcium, would that prevent
It's not going to go
that?
to the bone, it's going to get pulled out into that, yeah. It's not going to be in the right spot. It does increase the calcium. Okay, next one. Okay, you guys ready? Okay, let's discuss. A 40-year-old female client with recent thyroid surgery has been admitted to the hospital with a fever, tremors, profuse sweating, and anxiety. So what's it sound like is happening here? Thyroid storm, right? Everything's higher. She's got too much thyroid hormones, what it sounds like. Based on the client's symptoms, which drug class would be a priority to give this client? Okay. So, anti-thyroid medication? Yes, no, yes? Yes, because she has too much of the thyroid, so we want to stop that. So anti-thyroid medication. Antipyretic medication, what is that? Or fever, okay? She has a fever, and we're concerned about the fever, but if we don't fix the source of the fever, then she's not going to get fixed, right? I think a lot of our questions are priority. Might we give her an antipyretic after we give her an anti-thyroid medication? Yeah, we might. Probably will to get her temperature down. But we've got to fix the originating problem, okay? And a lot of questions that you guys are going to approach, there's several right answers. That's right. We're going to give them an antipyretic. But first, we've got to take care of the source of the problem. Okay.
I have a question. How are the signs in this patient different from thyroiditis?
Thyroiditis. They may be the same, not as severe. So she's asking how the signs and symptoms are different in thyroiditis versus someone in having a thyroid storm or thyroid crisis. It's the severity of which it is.
Yeah,
So-
but in this question,
She has-
if it was thyroiditis, how would you
So if it was thyroiditis, they may have a fever. The thyroiditis more is like flu-like symptoms, nausea and vomiting, not feeling great. They'll have a fever. They're probably not going to have profuse sweating. The anxiety's not going to be there. The tremors won't be there. Does that make sense? So thyroid crisis is like far into the spectrum. Okay. I was looking up on my phone here. I used to have this in my presentation, and I don't know where it disappeared. So the thyroid itself can store 50 days worth of thyroid hormones. So storing it. So imagine this patient had a thyroid surgery, we shook it up a little bit, and a bunch of that thyroid hormone that's been stored in there 50 days worth potentially comes out all at once. That's what potentially could be happening to these patients. So when we talk about having a surgery and having issues from that surgery, stemming from that surgery, it could be something like this, a thyroid storm caused by 50 days worth of thyroid hormones being secreted all at one time. Okay? So think that you see these tremors, profuse sweating. It's more than just like the run of the mill, I'm coming into the ER because I don't feel well. It's more of an urgent care visit. This is like, I feel like I'm dying. I have anxiety. I'm sweating. Think of the woman who just barely could speak because her heart rate was so fast. Okay? Okay. So here was a priority question, okay? So a nurse is caring for a client is diagnosed with hyperparathyroidism. So we know hyperparathyroid usually is high what? We think parathyroid, we think calcium, high calcium, right? So they're giving us our lab values. Our lab values are calcium 11.8. So we see calcium 11.8, we're like, 9 to 11, it's in there, maybe. And then our phosphate is 2.1, okay? Which our phosphorus levels, if you want to think through this whole process, is 2.5 to 4.5. So we're seeing high calcium in connection with a low phosphate level, okay? So that's going to indicate there's probably an issue. Those are both out of range for us. So what is our priority nursing intervention? Let's see what I say. Okay, so we are torn here. So complete set of vital signs. Why? There could be an issue with the heart, true. So we want to do vital signs, okay? When I put this up here and I say, you have all these options. You can do any of these 4 things. All 4 of these things are within your order set to do, okay? You're allowed to do any of these things, okay? We can complete a set of vitals. We can administer calcium supplementation, which nobody wanted to do that because you recognize that the calcium is high, right? We can assess the client for pain. Doesn't say anything about the client's pain. We could do that maybe eventually. Administer a phosphate supplementation. Okay, so we can do any of these things. We have labs that are telling me what? Our phosphate is low. Okay, and I have in my order set to give them a phosphate supplementation. But instead, I'm going to go and choose to take their vital signs. What do you think now? Do we still want to go take the vitals, or do we want to take care of our problem that we know is there? Talk to me through this, because these are questions I think that we're working out. We're working in our brain. How are we prioritizing this? Okay, but we already know this patient's problem. We have information, right? We could gather more information, but based upon this, if I know that their phosphate is low and I can give that to them, should we give that to them or go take vitals to see if something else might be going on?
Give it.
Okay, we can give that phosphorus. So the answer here is to administer the phosphate supplementation. Talk to me if you guys aren't understanding this.
I understand, I just don't like it.
You don't like it? I'm sorry. I don't make the rules.
Like, would we give somebody anything without getting vitals? Like, we know it's low, but like, what if they have an average?
Okay.
There's nothing else. The vitals were done. So like, is that us overreading it then?
Are you looking for more that's wrong?
No, just in case.
Just in case.
That is like the first thing they drill into your brain. Vitals, 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 vitals.
Right, but that's when we don't know any. If your patient comes in and they have these signs and symptoms, we're not sure what's going on, we haven't done any labs on them. Sure, let's take some vitals, let's do some good assessments on these patients, right, to figure out what's going on. But we have these lab values. We have something that we are looking at and saying, this patient has low phosphate. And we have in our arsenal, we have our orders from our physician, and the physician calls and says, hey, I noticed that patient's phosphate was low. Did you get that given to them? What would you say? I'm busy taking their vitals. And I don't mean that to be mean, and I promise you I'm not trying to get on to you guys. I'm just trying to help you guys answer these questions in the right order. This is a priority, okay? Yes, go take their vitals. We've got to take their vitals. And you know what? If somebody's going to grab, if you can get a buddy, hey, you go take the vitals, I'm going to go grab the medication for the patient, right? We could do that. But if we're looking to fix our patient, yes.
I can throw in, because the test question, you could always put every answer would be vital signs. That's the first thing you do. If you don't have enough information, you're going to reassess. But even in the STEM, which of the following is a priority nursing intervention? Obtaining vital signs is an assessment.
Intervention, something that you're doing, physically
Otherwise, how would we ask
doing.
the question to know if there's any intervention? Right? The question has to be worded in a way so that we directly towards responsive.
Does that make sense? A little more sense?
Yeah.
Okay. I know you don't like it. You don't have to like it. Just do it. You don't have to like it. You don't have to like it. It doesn't hurt my feelings. It's not my rule. But just pay attention when it's priority. What are we trying to get you to say? Okay? In the perfect NCLEX hospital. Remember, this is all in the NCLEX hospital. This isn't a perfect world. Okay? Where people are sick and dying and you have to take care of them. But this is the model patient. Okay? Yeah, I've never gotten that reaction from people before. Okay. I like y'all. Look. Okay, let's go. Okay, you guys ready? Yeah, I'm gonna lock in for time's sake. Sorry. Okay, so a nurse is preparing to receive a post-operative client following a parathyroidectomy surgery. Okay, so you're in the PACU, you're getting this patient. The nurse is aware that which of the following are potential occurrences with this type of surgery. Select all that apply. Bleeding at the surgical site. Yeah, we're always concerned about that. Okay. Post-operative hypercalcemic crisis. Let's discuss. Okay, we want to say yes. Why do we want to say yes to this one?
They might release.
Did I say that about the parathyroid or did I say that about the thyroid? Okay, so they had a parathyroidectomy. So does the thyroid regulate the calcium? The parathyroid. So we removed the parathyroid. So are we going to be concerned about a high calcium level? No. Okay, I didn't say anything about the parathyroid storing that calcium. Right? Following me? We talked about that with the thyroid, right? We talked about the thyroid. I told you the story where the thyroid can have what did I say, 5 days? 50 days. 50 days, my word. 50, sorry, I'm really bad with numbers. Hence why I have to do that. Okay, 50 days of thyroid hormone. So yes, the thyroid stores thyroid, those hormones themselves, but the parathyroid does not store calcium. Okay, so if we go take those out, we're worried about what?
Hypocalcemia.
Hypocalcemia. Okay, so might they transplant the parathyroid tissue in the forearm? Yeah, they might, that crazy wackadoodle cool thing. Okay, irritation of the thyroid gland.
Yes.
Yeah, so even going and doing a parathyroidectomy shakes up that thyroid and can throw us into a what?
Yes.
Thyroid storm or thyroid toxic crisis. Yeah. Okay. Removal of one or more of the parathyroid glands.
Yes.
Yeah. So it could be 1, 2, 3, 4, you know, any number of them that we can remove. Okay. Okay, so we have this client, hyperparathyroidism, which what do we think of? High calcium, okay? So the nurse knows that this client is at risk for other comorbidities. Sorry, I'm gonna walk y'all in because we got time's not on our side. Okay, so let's see what we wanted to say. Okay, gastritis and Crohn's disease. Did we talk about that? Does that have anything to do with our calcium? No. So that's not a risk, okay, not at a higher risk for gastritis, Crohn's disease, or diabetes. But coronary artery disease, yes, because we have a higher level of calcium circulating, okay, causing deposit buildups in the blood. Okay, so we're worried about coronary artery disease for these patients. Okay, so we have a patient recovering from a thyroidectomy. We took the thyroid out. They start to complain of tingling, numbness in the face, toes, and fingers. Which of the following below warrants attention? Okay, you guys got that one. Calcium. So why might have their calcium levels have gone down if we took out their thyroid?
You stunned the parathyroid.
We could have stunned the parathyroid to where it's not secreting, or we could have taken it out accidentally, right? Because they're nuzzled in there real tight. Okay. And then, is this a normal sodium level?
Yep.
Normal potassium level?
Yeah.
Yeah, 3.5 to 5 bananas. And then our phosphate level normal?
Yep.
Yes.
Ooh, a nutrition question.
This is right.
So what foods that are high in what are we looking for?
Calcium.
Okay. So we saw hypoparathyroidism, we see that they have low calcium. So now we gotta figure out what of all these foods has high calcium.
There's something she's saying about broccoli.
Okay, for the sake of time, let's see what y'all wanted to say. Yay, B is the correct answer there. Okay. I am not a whiz with nutrition. Sometimes it's a shot in the dark for me, but I do know cottage cheese is dairy, calcium, broccoli is dark, so dark leafy greens is what I think of, but that could be a wrong thought process. But
Are peaches high in calcium?
it's a great question.
I wasn't sure if that's a weird one.
I don't know. Good question. Don't know. Let's Google that one. Nutrition is really a shot in the dark for me sometimes. Okay. Oh, let me read this one too. Sorry, that's all.
Yes.
Okay, you're providing discharge teaching to a patient who is prescribed calcium supplements with vitamin D for treatment of hypoparathyroidism. Which of the following statements by the patient warrant you to re-educate the patient on how they should take this medication? Okay. So when it says we need to re-educate the patient, is the patient saying something that's true or not true? Not true. So I'm going to look through these and I'm going to try to find an untrue statement. Okay? So I will also make sure I eat foods rich in calcium, such as dairy and green leafy vegetables while I'm taking this medication. Good, right? So that's a true statement. We want them to have more calcium, so they're telling you, I'm going to eat more foods with calcium. That's a true statement, okay? A side effect of this medication is constipation. Therefore, I should drink plenty of fluids. Okay? A side effect of calcium medication is not constipation. Or, I'm sorry, there's true statement. Yes, it is. But drinking plenty of fluids is good for them. Okay.